medical method. Today we're going to be doing my 5th video on the MMI because my 4th video was meant to tie all the loose ends, but I sort of went on babbling for ages, so this one is going to finally clear up the loose ends and sort of clear up the things that I've missed so far. So one of the things that I heard about before from all the forums, check video 1, I put a Google link to download the forum pages that I put in a document. They're really good. It'll help you heaps in the MMI and give you an idea on how to answer questions. But one thing that came up in my interviews, as it said in the forum, was dealing with actors. Now, in this situation, it'll say on the sheet on the door that such and such is. So let's say James's mother has just died, and she was the sole source of income for his family, and he's currently considering going into gambling and drug addiction, and you're treating him for some lacerations that appear to be due to suicide. Go in and deal with the situation. Okay? Now, you have a minute, probably less because you've just read the sheet, to prepare yourself for what is going to be an intense psychological and emotional test of your ability to be a doctor. This is up there with the Y medicine in terms of difficulty, because the actor is obviously very polished, a really brilliant actor, and you have to, it's sort of awkward because I guess it's not really a natural representation of how you would react. So you walk in, this person is crying, they're irritable, so no matter what you say, they're going to basically get aggressive with you. And I read on the forum pages that some people, literally in this question, just walk in and start crying. Okay? Now this is another general tip. They take your best 8 questions out of 10. So if you walk in and start crying and absolutely destroy that question and just like basically start crying and you know you got a 0, you don't let it phase you, okay? I had ups and downs in my interview questions, and I knew that there was a couple of questions, probably about 2 questions, where I didn't do well. But I didn't let that affect my next one, because the best thing about an MMI is it's a clean slate every time. Okay, every video I've watched this says it, and I'm going to say it again. Every single room you go into, you've got a chance to get a 10 out of 10, or in their case, a 5, 5, 5, 5. You want to kill it every time, but it's impossible. You're going to have 10 different interviewers, 10 different people who will have different questions and different opinions of you. Just try to do your best throughout. Okay? Anyway, going back to the question. The best and most important thing in this question is to show empathy, show the ability to listen, okay? And there's a few things you must not say. Don't say it's okay. Don't say I understand. Don't say anything like I feel sorry for you. What can I do? All those kind of questions, okay? Again, you have to show that you have command over this situation. This person is lost and is looking for support networks, okay? So the most important bit in this situation is to be slow in the way that you act, because it is really an acting job. So say to the person, can you just explain to me how you're feeling, explain to me what's happened to you, let me know how it's going, just give me a full history of how you're feeling and why. It's the most important thing. And then just sit there and listen. This person who's there acting will just make up whatever, like fits the bill, whatever they've learned. Now, the key is talk about generalistic things that you would think a doctor could say that could be helpful, because in reality, nothing you can say to this person is going to fix their situation. But you can say things like, look, tough times occur to everyone. The drugs isn't a solution, okay? What you have to do is look at all these different support networks that are around you. Counseling, your parents, your dad, your kids, your wife, me. We're all looking to support you. You need to talk to us, okay? Tell us how you're feeling every day. We can organize times to meet together. Like all these things that show supportive and caring instincts but without being dismissive, because being dismissive is a thing that is easy to do. Look, it's okay, you'll be alright, don't worry, you'll get better. That doesn't help, okay? That doesn't help this person who has been psychologically bruised and battered from the situation. Okay, so the keys to answering questions where they're actors are as such. Be empathetic, listen, be sure not to be dismissive, and give constructive solutions as best you can. The best ones are counseling and support networks that you would use if you were a doctor, because they're the only ones you can do, because in reality there's nothing that you can do as a person to really help. Okay? I think that clears it up. Comment, rate, subscribe. Email me any questions you have. I might make another video. I'll definitely do some more GAMSAT videos, but in terms of the MMI, I think I've pretty much covered everything. Thanks for watching, and see you later.